Hello everybody! In coordination with the Fluoroquinolone Toxicity Study Foundation, here is part 2 in a 3-part series titled The Overlooked Risks, Medical Scans, Contrast, Anesthesia, and Fluoroquinolone Toxicity, which will focus on contrast dyes. Contrast dyes, like those with gadolinium or iodine, help improve MRI and CAT scans, but they may pose issues for people experiencing adverse effects from fluoroquinolones. These type of antibiotics have been linked to mitochondrial issues, which can cause oxidative stress and sometimes impaired kidney function, which is the organ responsible for excretion of substances. The following are just 2 of the many contrast agents. 1. Gadolinium-based contrast agents, GBCAS. Recent studies showing gadolinium can possibly accumulate not only in the kidneys, but also in other organs, even in people with normal kidney function, more typically after repeated exposures. Health issues can also increase with higher contrast concentrations and with particular brands of contrast agents. The amount of contrast used in an MRI depends on the specific imaging needs in the area being examined, so this is useful to find out in advance. There are 2 types of gadolinium-based contrast agents based on their chemical structures. The first one is linear and the second one is macrocyclic. The linear contrast agent results in more retention within the body for a longer duration. In review of the research, it appears that any consequences of residual GBCAS, also gadolinium-based contrast agents, which are deemed to be slight, have not been greatly investigated. 2. Iodine-based contrast is used for X-rays and CT scanning. These messages were cautioned in part 1 of this series. It is considered relatively low harm, although still a chance of severe adverse effects. However, some patients with pre-existing cardiovascular, respiratory issues, or damage to their blood-brain barrier should be aware. Unfortunately, there is a lack of contemporary studies and ongoing research to clarify the true risks, including those of the kidney and thyroid issues, which remain unclear. Reactions can be dependent on contrast volume as well as the route of administration. Here are some non-contrast imaging alternatives: an MRI without contrast or an ultrasound, CAT scans without contrast, again see part 1 in this series for warnings, a functional MRI, fMRI. This specialized type of MRI detects changes in blood flow and brain activity. Non-contrast MRA. This is an advanced technique to image blood vessels. Here are alternative contrast agents. Vegetable-based dyes are sometimes used in gastrointestinal and eye imaging, microbubble ultrasound contrast, and iodine-based MRI contrast agents, which use iron oxide nanoparticles, and availability is limited. Note: iron triggers Fenton reactions resulting in oxidative damage and cellular stress. This compounds the issues that many patients already have who are suffering from fluoroquinolone toxicity. If an MRI with gadolinium is absolutely necessary, you may consider discussing with a functional medicine doctor or a nephrologist to do some preliminary kidney function tests and kidney monitoring. Exploring macrocyclic type contrast agents and their potential side effect differences. Precautions to be taken before and after imaging. As with any drug or medical procedure, arm yourself with knowledge by reading the references under reviews, which will provide more overall detail. As with the first series that has already been released, we would love to hear from you. If you've had health issues after contrast procedures, please share your stories in the comments. Your insights could help others navigate similar situations and help them make informed decisions with their doctors. Hope this video was helpful and gave you the information you needed to know around contrast dyes. Stay tuned for part 3 of the series, which will be coming shortly. And last but not least, I will have to say, and I will say this on behalf of myself and the Fluoroquinolone Toxicity Study Foundation, this video is based on experience and it is for informational and educational purposes only. We are not doctors, and we are not here to treat, diagnose, cure, or prevent any illness or disorder. Please work with your healthcare provider to do so. Thanks, everybody.